Over in January, we saw an increase in H2N3, which is an influenza virus, and that's the subtype of the virus. That was the one that was spreading in the United States, in Canada, in different areas. And we are able to test at the Central Medical Lab again. We test for influenza A, influenza B, COVID, and many of the other viral infections. The recent report shows that it has become now stagnant, and hopefully we'll see a fall in this. We also, I want to take this opportunity to say that we also have the flu vaccine available at every health facility, private and public, and the pneumococcal vaccine that helps to prevent pneumonias and other diseases in children and adults. So I encourage you all to go out and get this as soon as possible.
And talking about vaccines, we know during the COVID there was a lot of talk about vaccines. Since then, have you seen any change in terms of people seeking certain vaccines?
I think initially after COVID, not that I think, I know that we had a significant fall in our routine vaccination programs for most of our vaccines. Now we have recovered very nicely, and I'd like to say that, for example, the HPV vaccine, which is the human papilloma virus vaccine, and it prevents cervical cancer, for example, 90+% of cervical cancer is linked to HPV. Initially, post-COVID, we had fallen to about 38%. And our reports show that for 2025, we're at 76%, which is wonderful for us, and which really helps us to eventually get to the goal of the elimination of cervical cancer in our country.